Thank you. This talk is about URAMS, and we're going to look at how this outcome measure. Outcome measures, you can have generic, you can have area-specific, like the DASH for the upper limb, the PEM for the hand, or the Michigan Hand Questionnaire that Zav just spoke about, which is also for the hand. Or you can have a disease-specific outcome measure, and the URAM is a disease-specific outcome measure. So this is the URAM that was suggested. It is a French score, and it was published in English. And my assumption was that it had been validated in English. I'm told by David Warwick that's not been, the psychometric testing for this outcome measure has not been done in English. But essentially, it is 9 questions, all to do with disability due to a flexion contracture. So that is what you're doing. Apart from this one, which is the thumb, so this looks at radial-sided Dupuytrens, but all the rest look at the digits. And you get these 6 interval scales, and note that there is nothing in the middle. So you can't say neither good or neither bad. You have to choose between good and bad. Now, I've already spoken about the PEM, and you know the score now. It's a visual analog scale, and those are all the areas that it covers. And again, we looked at only Dupuytren's patients. We looked at 1,200 here, and we had 146 that had refused. So out of 940, we had 531 that responded and completed the PEM, the PEM and the URAM. And again, we had patients that were operated and not operated in this group. The same transition question as before, bearing in mind your initial disorder. Are you cured? Are you cured, or are you terrible? And you divide them there between better versus worse. Now, the first thing is the minimum clinically important difference for URAM, which is given in the paper as 2.9, and we agree with that. It's 2.6. We use a slightly different method of calculating the minimum important difference over here that the patients perceive as a clinical benefit. It's 2.6 on the score. So that is the first thing. The second thing is that we compared the URAM with the PEM, and you can see the grades of change versus the score over there and the score over there. I'll show it to you visually here. And what you can see immediately, the blue bars are URAM, the pink bars are PEM, and the PEM keeps rising, but the URAM flattens over there. So there's a clear ceiling effect in the URAM because there are no domains in the URAM to do with complications. So you're not picking up complications. So you're not picking up the effect of change that intervention can impose on the patient. The other way of looking at URAM and PEM is to do a linear regression, and 71% of the change in the anchor question is explained by the PEM, but only 53% of the change in the anchor question is explained by the URAM. So it's 20% less good than the PEM. And there's a ceiling effect, as I've said. So finally, we asked the patients, and we asked all our patients, we had 455 responses, do you think that the URAM reflects the problems that you experience? And 24% said no. So it seems as if the URAM accounts for 3 out of 4 patients, but not all. So the summary then is the URAM reflects the contracture of the finger and the disability of the patient. And the minimum, if you're going to use the score in preparing studies, clinical studies, comparing groups, then you need to be looking at that minimum difference of 2.6. However, we must know that it does not fully capture the state of the hand, particularly after intervention, because it does not have aspects that capture things like pain, dysfunction, overall dysfunction, and all that. It is worse, and this is surprising, that it's worse than a generic hand questionnaire. Usually it's the other way around, where if you've got a disease-specific questionnaire, then it tends to be better than a generic questionnaire. Here, that is not happening. And therefore, you'll be very cautious about studies that use URAM because you're expecting it to not show a difference in studies. So it is worse. And so we think that if it is going to be used, it must be combined with a generic hand questionnaire, either the PEM, the Michigan Hand Questionnaire for research studies, or the DASH, which is the whole upper limb. Thank you.